Good afternoon, Emerson. How are you doing today?
I'm good, thank you.
That's great news there. Today we're just going to go through our adult pre-exercise screening system. The aim of this is to identify individuals with a known disease or individuals who may be at a higher risk of an adverse event due to physical activity or exercise. So our first question here today is, has your medical practitioner or GP ever told you that you have a heart condition, or have you ever suffered from a stroke?
No.
Alright, great news there. Off to a great start. Do you ever experience unexplained pains or discomfort in your chest, at rest, or during physical activity?
No.
You don't? Alright. Do you ever feel faint or dizziness, or lose balance during physical activity?
No.
Have you had an asthma attack requiring immediate medical attention over the past 12 months?
No, I haven't.
Have you had asthma at all?
No.
Or do you suffer from asthma?
No, I don't.
Alright, great news there. Do you suffer from diabetes type 1 or 2?
No.
Alright, so I take your glucose is or blood sugar is at a good rate there at the moment? Alright, great news. Do you have any conditions that I should be aware of?
No.
Nothing at all. Any special considerations before we take part in exercise?
No.
Alright, so have you seen your GP recently, and have they given you a medical clearance?
Yeah, I'm fine to start exercising.
Alright, that's great news there. Okay, so we can move on. So if you don't mind me asking, can you describe currently what your day-to-day routine of exercise is, just over a time frame of 1 week, if you don't mind? Sorry, excuse me there.
That's alright. So I like to walk every day or try and fit in a run if I can't do a walk.
Okay, sure. That's pretty good. They're fairly fit, I guess I would say. Do you partake in weights, for example, as well? Also, you go to the gym maybe?
Yeah, when I get motivated, I would, but not at the moment. I haven't been.
Alright, so not too frequent.
Not frequently, no.
Okay, sure. Okay, we'll move on. Thanks for that. We'll move on to the next question. Can I just get your age? Obviously, you're not over the age of 45.
No, I'm 20.
Okay. I thought that's a good age there. Do you have any family history of heart disease? Has anyone in your family ever suffered from heart disease?
Not heart disease, no.
But they have suffered from some sort of heart issues before?
Yeah, heart attack. My grandmother.
Your grandmother's had a heart attack?
Yes.
Okay, sure. Great. I'm guessing you don't smoke? Do you smoke? Okay, sure. Great news. Have you been told that you have high blood pressure? Sorry.
No.
Have you checked your blood pressure recently?
Yeah, within the last 2 months.
Okay. Do you know?
A normal range.
Okay. Do you remember those numbers?
Not exactly.
Yeah, sure. But I will let you know. Someone at your age, at 20 years old, the range that you should be looking at is 100 over 140. So that's the systolic blood pressure, which is the top number, and diastolic is the bottom number. So maybe if you could go to your GP there and maybe get back to me on what your numbers were also.
Yeah. Just
so I may be aware there. Have you been told that you have high cholesterol?
No.
From high cholesterol, you don't?
No.
Okay. Have you been told that you have high blood sugar?
No.
Are you currently taking prescribed medications?
No medication.
Okay, sure. Great news there. Have you spent time in hospital recently for any medical conditions, illnesses, or injuries in the last 12 months?
No, I haven't.
Are you pregnant, maybe?
No.
No, you're not? Have you given birth in the last 12 months?
No.
You haven't? Sure thing. Do you have a diagnosed muscle, bone, or joint problems they have been told could be made worse by participating in exercise there?
No.
Okay, sure thing. Just the last thing we're going to do here is just get your measurements. So we'll get your BMI, obviously, your body composition, which is also a few things we want to get before we do that. So your height and your weight. So just following me when you're ready. Thank you.